Hi, good morning. So I'm gonna perform an oral care. So first and foremost, of course, check the patient chart, obtain any relevant information which is important. And then once inside, of course, we should gather all the supplies that's being needed for the oral care. Of course, we should always wash our hands or hand sanitize. And then once inside, we should also have wear gloves, appropriate PPE such as masks, and if possible, an eyes goggles. And then once inside, of course, we introduce ourselves, explain to the patient what's the purpose of this, such as this would help them prevent from being risk of any ventilator associated pneumonia. And then we also have to inspect the patient's oral airway, especially if there are any presence of ulcerations, oral trauma, or any inflammation on it. And then we also have to ensure that we check the ET tube if it's what's the appropriate lip level. And then we also have to listen to the breath sounds to ensure if there are any abnormal lung sounds, and also obtain any vital signs. Once you're done, we also have here a suction wall outlet, should be connected in the wall. Make sure everything is complete and it's being tightened up. And then with this, we also have to insert it up with a yonker. So with this yonker, we also have to hook it up with the suction catheter in place. Make sure it's tight and secured. And then first and foremost, we also have to check if it's able to suck it up with a sterile water. And then with the pressure, make sure we set it up with the appropriate suction pressure, especially for adults at -100 to -120. So once you're done, we put this in the patient's oral airway, of course, suck it up, and then make sure we prevent from any pooling of secretions, prevent from risk of aspiration. And then another thing is we also have to ensure that the ET tube with an ET tube holder should be try to move it try a little bit from side to side. And then when doing suctioning, we also have to try to suction from the sides of the ET tube if there are any copious secretions or thick secretions that are being stick up in the ET tube. So once you're done, we have to put this in a safety container to prevent from any contamination. And then usually oral care is done at every 2 hours. So after 2 hours, we have here the moisturizer and also for the oral agent. So for the oral agent, we're gonna put this, inserting it in this one, and then make sure we try to dip it, the whole green thing. And then we also have to insert it in the patient's mouth. Make sure we include it on the sides, such as in the gums, the cheeks, and even the palate or tongue. So once you're done, we dispose it immediately. And then we have here, which is not being inserted on this blue thing, we have here a moisturizer. So the reason is to prevent the patient from having a dryness on it. So when doing this, make sure it's not being clumped. Make sure we expose this whole green thing with the moisturizer, and then we make sure that it's being cleaned up, especially on the lips. And then after that, we dispose, of course. So after 2 hours again, we have here the toothbrush. So with the toothbrush, we usually don't suction it together, but first is we have to inspect if there are any secretions present. So first is we have to suction and remove it. So with this toothbrush, we insert it in here. So we have to try to put a solution on the toothbrush. We have to brush it up in a circular motion from the sides, the back, and also on the below on it. So after brushing, of course, we remove it. So brushing, as what I said, we usually done every 12 hours. And then after brushing, we still have this green thing. So this is to help from the patient being moisturized. So we have to put it up again, a moisturizer on it. And then when moisturizing it, we should include it on the sides, especially in the cheeks, and also on the gums, teeth, and even most of all, the lips. So once you're done, you should always dispose this one up. And then after another 2 hours, we have here a catheter. So with the catheter, we're gonna insert it up in here and then hook it up. Make sure we try to check the suction pressure if it's able to suck it up, and then make sure the connections are not loosened up, it's being tight. So when you suck suction the patient, make sure we suction it not too deeply to prevent from initiating its gag reflex, and then ensure that we're able to suck it on this side of the ET tube, especially if there are secretions present that's being stick up on the ET tube itself, and then try to suction everything, and then once you're able to suck it up, remove it and dispose.